Some of the side effects of these synthetic estrogens, and ladies can bear witness on this one. Number one, of course, hypertension. There's always an increase in blood pressure. Number two, of course, severe acne. We call it cystic acne. Now, when you go to hospital or your gyna, he tells you this is hormonal imbalance. Go and take another estrogen. Go and take this contraceptive method to balance your hormones. Now, how can you treat estrogen problems with estrogen? And they are always having supplements. Look at the walls of your gyna in that consultation room. They always have some product from a certain company trying to market it. Just the same way dentists do have products from pharmaceutical companies to just market it to you. And you know that dentist who keeps on dancing? The dancing dentist, you know him? Of course, so we've said hypertension, we've said acne, the cystic acne, we've said, of course, bleeding between periods. Sometimes you just bleed for no good reason, vaginal spotting, and it's so annoying. And when you keep on bleeding, of course, anemia is coming in, so that's another problem. And then these hormones, these estrogens, they lower immunity, so therefore a risk of infections all the time. So women have recurrent yeast infections every single time. Nobody's talking about the contraceptive that they're using, but everybody is quick to give you an antifungal, quick to give you an antibiotic because of the recurrent infections in your vagina. So now it's a drug on top of another drug. So we're actually using a drug to clear the side effects of that drug that you're using. So nobody wants to talk about them. No, it's not about the contraceptives. Keep using them. But we will have a drug for you, a solution for the side effects of that contraceptive. Okay? You now see how the system is? It is designed that way. Of course, weak bones in women, severe fractures sometimes, hip fractures and all this. And then obesity, weight gain that is coming in as a result of estrogen, because estrogen is a fat depositing hormone. Estrogen also activates the liver to produce more glucose. And as you produce more glucose, you bring in insulin, you are in storage mode. You keep on adding weight. Now you'll walk into all those weight loss groups or platforms. You will never lose that weight. These are the things that we teach you in our weight loss groups or our weight loss cohorts. So I've told you about hypertension as a side effect. I've told you about acne. I've told you about vaginal bleeding and the dryness. I've told you about low libido. Women nowadays, as you grow older, you're supposed to be sexually active, but as you grow older nowadays, because of estrogen, sex drive is zero and you're struggling. You're looking at this man and wondering, the vaginal dryness. And then now the system knows that you're having a dry vagina, and then they give you the alternative or the solution through okra water. Now, ladies are trying to take that okra water through their throat. It's not going. You want the easy way, but the okra water does not go down the throat. It doesn't. Way. Another one is weak bones. Another one is cancers, of course. Cervical, breast, ovarian, endometrial cancers are there. Another one is, of course, the gallstones. So if you have gallstones, start watching your estrogen levels. Of course, the thyroid problems, because estrogen is toxic to the thyroid. And then, of course, migraines. Sometimes women get convulsions. And then endometriosis and all these, the PCOS, the infertility, all these are issues that are coming in with the synthetic estrogens or extreme levels of natural estrogens. So we need to bring them down. Okay? And on this point of the migraines, so many women are suffering migraines every day. Most women are on Maramoja or the Paraflash, the one that you dissolve and then effervescent tablet for pain. Most women are addicted to Bitapin. Some of you are on tramadol every other time. You are an addict of these drugs because of the pains, the migraines, and the headaches that come as a result of that contraceptive that you're using. And nobody wants to tell you about that. Please, get rid of that thing. Okay? Get rid of that thing. But for the side of progestins, most of the times they are the ones that are important in the healthcare system, because there are women who have threatened abortion because of high estrogen again. So we can give you a progesterone-only pill or the contraceptive that have only progesterone to actually prevent you from getting that problem. It's also used in hormonal replacement therapy, the HRT. These are the progesterones. We can also use them for uterine bleeding. We can also use them for endometriosis. But why would you go for a pill instead of just changing what brought you high estrogens? You see what I mean? That's why we are focusing on the preventive more than the curative medicine. Okay, and then they can also be used. These are the progestin ones. They can also be used during the premenstrual tension. Some women get so tense, so panicked. Anxiety comes in and the confusion before they get their menses. So this can actually help you there. Okay, yes. But there's a drug that is used for uh, to induce abortion or to induce labor. It's called mifeprostone. That's a drug that is actually misused nowadays, and I really get so sick when young ladies come into my inbox and they're always asking about an abortion. Listen, if you want an abortion, you know the hospitals that do these things. They advertise it on TV. Stop wasting your time. Do not, please don't do that. Simply remember, I knew God before I knew medicine. Now, do not wait for my response on that inbox because it comes out so harsh, okay? Yeah, because I have to slap you back to normal. If you have sex without a condom, you will get pregnant. You will get pregnant. So why are you in campus and having sex without a condom? Why? You're wasting yourself for your future man. Ladies in campus, please, you're wasting yourself for the future man. Having sex all through without protection. Withdrawal is risky. Wait. As I'm actually going to the contraceptives now, and I'm going to talk about withdrawal. A scam of the year. Hey. And you're trusting a drunk man to withdraw. Yeah, sometimes we joke a lot, right? Ladies, you're trusting a guy you just went out with to drink alcohol. You're trusting a guy who cannot fast. You're trusting a guy who eats everything that passes by. Smokies, he's eating. Boiled eggs on the road, he's eating. Roasted maize on the road, he's eating. He's eating smokies at the same time eating chapati that is rolled. And you want this guy to pull it out for you. Oh, one, he will not afford the P2. Number two, he will actually, they call it skipping. He will skip that pregnancy. And you know very well, the pregnancy that you skip, that child comes out exact copy as this gentleman. But this gentleman is not your alpha male. He was just having his fun. Now he cannot afford the P2, and now he cannot afford that. Hey, whatever, man. Ladies, don't risk too much. Okay, and again, you will be lucky to get pregnant, which is a good thing. But how about the STDs and STIs? How about those? Even ladies who put on in campus, I see ladies have put on already a contraceptive that is going to last them 3-5 years. You're actually preventing yourself from getting pregnant. Then when you will want to get pregnant, when it will dawn on you that now the woman instinct is hitting you hard, you will suffer the consequences because it's not going to happen. And if it happens, you will give birth to retarded children. A child you leave in the house and is drooling saliva from morning to evening. You come back, it's just the whole floor is saliva. And you start wondering, oh, this is in Uchawi. My people are actually working so hard to make sure that I don't survive in town. You can see they have gone through my child. No, they didn't go through your child. You fed your child with these contraceptives from the... Anyway.